number one is access. If a doctor doesn't have to have 2,000 patients on their panel and they can have 50 patients, then you're going to be able to get to that. You're going to be able to get to their things by the end of the day. So, meaningful access during the day, after hours. If something needs done, it can happen now, because the whole concept is that with a membership fee instead of fee for service, which is me, churning for pennies, I do not have to worry about padding my patient panel with a million patients that I can't actually help.
My next question would be, how did you land on direct primary care now that you've been through all of this, instead of like concierge medicine or some other model?
So that's a really interesting thing. I'm curious. I'm going to ask the question back to you. What do you think the difference is between concierge and direct primary care?
Sounds fancy pants. I don't know. It sounds like they do charge quite a bit more. Like they do house visits, and people pay a premium for like the doctors to come by and provide services, which I guess you could also be doing as a direct primary care provider, right? Are you doing house visits,
I
or do
am.
you have a
I
brick and
am.
mortar? Oh, okay. So then you are
So
a
this is
concierge,
the
fancy
the
pants
di-
person.
the difference between well, so there's two things. This is a great topic because I believe that the term concierge medicine implies elite, inaccessible, super expensive, and it signals to doctors that you are not able to have boundaries with your patients. That is sort of like the look of it. And I think that we just need to change the paradigm to not call it concierge, but say the only difference between this care and the care that you're receiving already is that I no longer am requesting reimbursement from your insurance company. I'm directly billing you for my services. And because I don't want to be incentivized to just see more and more people, it's just a flat membership and that manages your health. So, one of the things, concierge medicine, it makes people angry. It makes people it makes patients think that doctors are greedy and leaving the system because they want more money and they want to cater towards the rich. But the reality is I charge $2,000 a year for everything. That's
That's
like,
that's amazing, actually. It's a
and I'm just,
pretty
and
good
I'm gonna,
deal.
give you the math on this one because it's really important. So $2,000, I think, is really a good deal for what I'm offering as well. It's still an expense, and it's hard for people to justify uh, having an expense in addition to the expense that they're already paying into their health insurance premium. So I don't want to discount the fact that it is an expense on top of that. I want to do the math on this. I had 2,200 patients in my practice and I was in negative. I was not, my overhead was too high for me to bill enough because I chose to spend time with my patients. That's like what I did. Um, and in this case, let's say I cap my patient panel at 500. 500 is nothing for a PCP in this world. Like with when we've had two, I'm like I know people who've had 3,000, 4,000 patients in their panel. So 500, that's $1 million a year. That's $1 million. So $2,000 is not it. Do you see how it's like it just makes so much more sense. But you don't have to have 500 patients, and I don't intend to have 500 patients. I simply want to do the best I can with a small amount of patients. And then the as I build up my practice where I have enough people paying that full amount for the membership fee, then I would like to be able to subsidize the care of lower income patients. And I think that direct primary care, to summarize, is the fact that we do not bill your insurance for your services, we directly bill you. And the other thing that is somewhat different from concierge is sometimes concierge medicine has a membership fee and they bill your insurance. So that's another thing. But to go back to your original question, why this? Um, it's because in medicine, the way that it was, the way that I was practicing in the fee for service model, I only got reimbursed for the thing that I did in the appointment. And we all know that there's things that you do before the appointment and after the appointment and everything to do with the follow up of all of these things that you are not reimbursed for your time. You're not reimbursed for that. And so one patient might see me, let's say 3 times a year. And let's generously say that I bill $250. Like that's the max of a visit that a family physician can essentially make, is like 250 for like a visit. Okay, so now I'm managing all of their stuff for less money. Like I'm not getting that. And because I'm reliant on appointments for money, I need to make sure I have this huge panel of people to fill my schedule. So doing a member saying, listen, I'm just going to charge this. I did the math on it and I was like, this makes a lot of sense and it actually works. Could I charge more? Yeah. Do I want to? No, because I think we need to demonstrate to the government, the insurance industry, and the patient population that healthcare is the cost of healthcare is inflated by the health insurance industry. And it is very possible to provide very affordable quality care for, like I said, $2,000 a year.
Can you tell me from the patient's perspective, how does this benefit them?
Oh, that's perfect. So I guess what I want everybody to do is imagine the last time they got sick. And let's say it was 5 p.m. First of all, you're not getting into your doctor then. So you're probably going to go to an urgent care. Uh, we all know that those are kind of run by, they're usually for-profit entities that are churning through patients. They throw antibiotics and steroids at patients without giving any kind of guidance. And I don't mean to throw healthcare workers under the bus. That is what you're forced to do in that scenario. Like when you're given that much volume and responsibility, it's like you just start doing that kind of thing. So, and you're probably going to get like a $200 bill from that urgent care. And you didn't really even get helped or you didn't get guidance. So number one is access. If a doctor doesn't have to have 2,000 patients on their panel and they can have 50 patients, then you're going to be able to get to that. You're going to be able to get to their things by the end of the day. So meaningful access during the day, after hours. If something needs done, it can happen now, because the whole concept is that with a membership fee instead of fee for service, which is me, churning for pennies, I do not have to worry about padding my patient panel with a million patients that I can't actually help. Because the doctor is no longer reliant on fee for service, you don't always have to go in for a thing. So like I had a patient a couple days ago test positive for COVID, and I didn't go, okay, well, you'll have to make an appointment. I was like, okay, I was just, hey, are you feeling okay? Like I had a very quick, like back and forth, and then I just was able to treat them and give them guidance via the portal and stuff and all that stuff without inconveniencing them and having them have to leave their work day and all these, whatever it is. I was able to manage it then, and I was able to manage it in a way that actually was helpful. I gave so much guidance on symptom control that I normally wouldn't do. I just don't have time. So you have not only you have access, you have time. The doctor is no longer going to see you as a person with one problem at a time, but they're going to be able to see you as a whole patient. To give an example of that, my first appointments for all of my patients have been 90 minutes. And you know what I do? I just let them talk. Just talk the whole time. Tell me what you want to tell me. And sometimes they just want to get it all out and they know that they can't address all of that today, but they feel good having let it all out and feeling like you heard them, that they have all of these things going on. And then you can say, that is quite a bit. I've written down all these things. Which thing do you want to do today? And then we can follow up tomorrow or when, because there's a lot of space. We can chip away at this. So essentially time, access. I've been able to see patients in a continuity way, like week after week for things. I've been able to check in on progress with their medications the next day on, on their text messages. Or do you know what I mean? Like, hey, how are you doing on this? That's what it is. It's what you imagine primary care to be. It allows the physician, the family physician, to operate at the top of their license and at the top of their education level. There wouldn't be a 3-year residency for family medicine if we were intended to just be a glorified referral specialist. We have extensive training in all areas. And are we specialists in all areas? Absolutely not. However, you can attest to this. How shitty is it as a specialist to get a neurologist to get in a consult for headaches when the doctor didn't do anything? What a waste of resources. What a waste of a neurologist specialty. Family doctor can start the process of the headache workup and the headache treatment. We can go as far as managing I can do a Jovi, I can do all the things. And then if I'm just not getting there, then the specialist comes in. You guys get burnt out because you are not able to operate at the top of your licenses because you're managing low level crap, that PCPs just referred for, so that's another thing.
Yeah, the worst is a referral for headache, and patient has been treated with Norco. Yeah,
And you're like, what are you, what? I mean, just even
stop Norco first.
like, what are you talking? I mean, headache is my favorite thing, by the way. Like, I love headache work, but you can't do a comprehensive headache evaluation without a lot of time, in my opinion, like to really, because usually it's multifactorial, right? You've got I don't need to tell you this, but I mean, literally, here's an example of a fragmented problem. I had a patient that had a meningioma, and she was following with her neurologist for the meningioma, and I didn't see her for a really long time. And then she came back to do FMLA with me for headaches. And I was like, wait, what's happening here? Like, what just happened? And it turns out that she kept going to her neurologist, who had very little time with her, and was saying, I've been having these like she's expressing that she's worried that the meningioma is getting bigger. Okay. And she's like, I'm having headaches. I think the meningioma is getting bigger. And this neurologist just kept ordering MRIs and saying, it's not getting any bigger. But they weren't doing a comprehensive evaluation of the headache because they were consulted for the meningioma. And honestly, I think you both can agree that that's shitty care. Like, they should have gone the extra step. But this patient literally ended up in my office trying to do FMLA for headaches that they thought were the result of a meningioma that wasn't big enough to get rid of. But this is just their life now. I literally had her come in. She had like serious sinusitis. She had like allergic sinusitis. I gave her Flonase and her headaches resolved. It was not that complicated. But because we had pushed her to a specialty, and the specialists don't have time, just like we don't have time, stupid things happen, like MRIs every 3 months for a meningioma that's stable, that is not the source of the headache. So yeah, that was crazy to me.
How did you financially and logistically prepare for this transition? And I feel like that could be an episode in and of itself. But
Mhm.
briefly, if you don't mind telling us, because we doctors are not business minded, right? I think a lot of people are like, I want to start my own practice, but like, where do you start? Like, do you need a brick and mortar? How do you pick an EMR? Do you need an office manager? How did you
Yes.
kind of put all of those things together?
Well, that's a great question. Now, I first want to address your first statement that we doctors are not business minded. That is something that we have been indoctrinated to believe about ourselves, that we are incapable of figuring that out. I'm sorry, ma'am. We did, in some cases, 12 years of higher education, 15 years of higher education, doing complex things. We can't figure out how to do this. I think we can. Now, That being said, it is difficult and you have to do a lot of learning, but you're absolutely capable. We're all absolutely capable of it. So, the first thing that happened was you have to get in with a group that knows what they're doing. And there's something called the Direct Primary Care Alliance. And that's kind of where I began was I was looking to how did other people do this? Um, and there's direct primary care conferences. There's all kinds of things. So first tap into the people that are doing it and figure out what they're doing. I want to also plug that there's also a direct specialty care alliance. So I know that you struggle with like, burnout and stuff like that. That exists too. A direct specialty. There are oncologists that are doing direct care. So just think of that. Um, so the first thing that you want to know is you can actually have a pretty low overhead if you just do telehealth and home visits, because you're not paying rent. You're really just going to pay for your electronic health record and any of the legal things, startup, stuff like that. But my overhead has been very, very low. But really, yes, this could be its whole own, it could be its own topic. I think people overly commit, they overly spend to start a business than they need to. You can keep things really simple, and there's just so many resources to help walk through that. It's just too much to kind of like say. But I can say that you don't have to have an extremely high overhead. I will have a brick and mortar. I just decided to invest in, I wanted to be an owner tenant, and I'm building a new, I'm a part of a new medical building that's being built. And so it's just not built yet. Um, that is scaring me because of the cost. I've started a business that's based on discretionary income in a time when people's discretionary income may not be there. We're seeing my the cost of the project going up, all these things. So that's scary, but you don't have to do that. You could just rent a one room. You don't really have to have crazy things. You don't we we forget. I know you know this. Think of how much you know from the physical exam. You can almost diagnose things. I know you can probably, what things are for the most part, just based on history and physical if you do a really comprehensive thing. And really, the imaging is just the confirmation, or to rule out something really scary. But you don't need all kinds of crazy things. You can just, if you have time and a room, there you go. So it doesn't have to be so complicated.
Right. And just real quick, touching on the discretionary income component, I know one big thing that I've heard patients say when it comes to DPCs is, do I also have to pay for my own insurance premiums? And if so, how am I justified in paying the premiums plus also you annually? You know what I mean?
Exactly. So the answer to that question is unfortunately, in the system that we currently operate in health insurance is currency. It's not actual insurance, it's your currency. I always think of it like a Dave and Buster's card that you prepay $10,000 a year for. And then you go to Dave and Buster's and they're like, we don't take this card. And you're like, what? So, like, that's kind of what healthcare insurance is right now. We need that currency. If you are getting imaging, all these things, that needs to be covered by insurance because at this time, that is just a necessary evil in the world. Um, so the question becomes, what is it worth to you to have the kind of access that you think you deserve? And this takes a really, you really have to take a hard look about, you have to say to yourself, okay, I should be able to get into my PCP in a reasonable amount of time. I should be able to not have fragmented care. I should be able to have more than 15 minutes of time. I should. But that is just simply not the reality. It is just not the reality right now. So if you want the kind of access that you think you deserve, it's going it's going to have to come at an additional cost. There's a lot of people that joined my practice initially that have been like, a little skittish about the economy. And so they're like backing off and they're saying things like, I don't really have anything going on. So I don't really think I need this. Like, I don't have problems. I only see the doctor, da, da, da. And I said, well, that's because your paradigm is sick care. Your paradigm is that you only go to the doctor when you're sick and you have a problem. We need to have an entire paradigm shift of what healthcare means. And that means that instead of you Googling turmeric capsules and you know, weird methylation things, like instead of you doing that, you can talk to your doctor about the symptoms. The reason why they do that is because they know they can't get into their doctor to just shoot the shit about random health stuff. Your doctor's not going to be able to come up with a nutrition plan for you. Your doctor's not going to sit and talk about how to motivate yourself doing exercises, how to, that it's just not possible. So it's not the question of, is it worth it? It's, are you worth it? Is your health worth it? Is your future worth it? In a time of uncertainty with everything else, don't you want a little bit of certainty that somebody's looking out for you? Don't you want somebody providing you the care that you deserve? That should be the standard. That's how I would say it is justifiable, but certainly not everybody can justify that. And that is also okay. That is okay. It's not for everybody.
That's a great point. How do you value your health? I think that's really, really important. And in this state, even with the insurances, I mean, my husband and I are both physicians. Supposedly, we pay for good insurances, and I mean, for everything, we get a bill in addition to the premium that we're paying. I mean, it's crazy that I hope
Yes.
one day we get rid of all these insurances, because I don't think it's helping. Yeah, maybe for even maybe for emergency services, but even emergency services. My son a few weeks ago had abdominal pain and he was inconsolable for an hour. We ended up taking him to the emergency department because it was 8 p.m. and the just one visit and one ultrasound, it was $5,000. I mean, it's crazy to me, and how patients can even afford this. And but the problem is, it's not even going to the physicians. I mean, who knows
No.
how much of that is going to the physician? Is minimal, a fraction, less than 10% of it, less than even that. Okay, so
Oh, yeah.
this is what patients don't even understand. So that leads me to the other question of, how do you acquire your patients? I'm sorry.
This is advice to anybody who is a current medical student or resident. Or if you're thinking about changing your practice in the future, karma exists. And if you treat people with respect and you do a good job and you actually prioritize their health, if you build it, they will come. So I was very lucky. I basically, what I did initially was, when I left, I had a letter that basically said, go to this website if you want to follow. I wasn't allowed to do any kind of solicitation for a year, but I was allowed to give a website in my letter. And so I had a ton of patients sign up for that. And ultimately, they miss the care. They first think they don't need to do this, but then they're like, wait, now I go to the doctor and I don't get listened to. I don't get and they were like, I kind of miss Dr. J running 2 hours behind, but spending an hour with me. You know what I mean? Like, I kind of miss that. So I was very lucky because I built a large panel of patients, and treated them well, I have had a substantial amount come with me, but it's slow. The second thing is, obviously social media is a thing. I've had a lot of patients sign up after finding me through social media. And my recommendation about that is to show who you are authentically, because that will attract people to your practice that like who you are authentically and work with you, so that's one thing. The other thing is leveraging the contacts in your system. So I have lots of physical therapists that as a physician, I worked with physical therapy. I worked with all kinds of specialists. So I can give them little flyers to have at their office, you know? I have business cards. I went and got my nails done the other day. I left a stack of my business cards at the desk. Um, and really, there's a million ways to market. Those are just the cheap ways that you can do yourself. But that's how I have been able to find my patients.
So in the last bit of time that we have left with you, I do want to talk about your social media because that's how I found you as well. Do you find that it has changed your views on healthcare issues? And do you feel like social media is helpful? Like, I personally feel like it has now because
Yes.
we're seeing a lot more people speaking up about the realities of working in medicine. Like, if only we had that, right, when we first started. But how has it changed the way you view current healthcare issues or how you might approach patients? And lastly, how do you deal with like the trolls?
Perfect. I love the question. I love the question. Um, the first thing is to recognize the trajectory of, let's just give TikTok as an example. We had TikTok docs kind of rose to fame during the pandemic, in the first few months of the pandemic, when it was like, we love all healthcare workers. And it was like, yay. And then all of a sudden they hated us. And you started to see social media become this cesspool for people who hate doctors and are seeking answers um, outside of Western medicine. And now you have charlatans and just people that left room for exploitation of patients. People selling you things for your gut health and tell, like, I'm not saying that these are not real problems. It's just that you're not they're exploiting this. They're exploiting the fact that you don't get heard, you're not heard in the healthcare system. So the first thing that happened was I went on social media and I realized how big of a problem it was, because I knew that I had a problem in the system and I knew my patients struggled in the system. But as soon as I started complaining about my woes as a physician, I can't tell you how many attacks. I mean, I was completely ripped to shreds in the comment section by people who are like, "Fuck you," excuse my language, but like, it, like, just
No, I've seen
yeah,
it.
like, you're greedy, you're this, you're that, you don't know, like, you don't care, and this, and I realized I saw the extent of the problem, and I saw how, not only, like, there was a time when if I was in an appointment and a patient was like, I think I have Lyme disease, I think I have this, I would have been like, oh my god, like, you know but the reason that they're there is because you have been unable to help them, and so they're looking anywhere for answers, and they find this shady person that's going to exploit them. And that feels good to them. So if you let your ego down, if you let your guard down and you really let go of your ego and say, you know what? You're right. Like, I should be able to answer questions about that. I should be able to counsel you on Lyme disease and all these things and explain what's exploitative and what's not. I should be able to do all these things. So I first learned the extent of the problem of how physicians will never, ever, ever, well, the healthcare system will never, ever improve if physicians are not seen as victims as well of the healthcare system. That's where it all starts and ends. It's just, if we don't have support from the community to support our well-being as physicians, our fair reimbursement, our lack of burnout, our ability to do our jobs without being encumbered by insurance companies all the time. Like, if we don't have the sympathy and the understanding of the public that we are also victims, then it's just never going to be, we're never going to get out of it. So not only did I realize that people didn't understand that, I also, because I engaged with people, I listened to their stories and I heard a lot more stories about crazy things that I was like, oh my God. I learned so much more about how, I mean, I know that gaslighting happens, but I've been really made aware of, like, just how bad it is, to the point where I myself have had had to have a reckoning with the things that I may have done to harm people in the past, like with that. So I do think social media is incredible for both physicians and patients if we all try to go at this from the standpoint of us against them. And I'm pointing up for the people who are listening. And that really is about the C-suite people, the hospital administrators, and the insurance companies, and the pharmaceutical companies, and the machine that is the healthcare industry. So I also think that with physicians getting more and more bold sharing their stories, not just sharing their own burnout stories, but sharing the stories of how they're trying to get things done for their patients and how they're being thwarted, that is educating. And they're starting to want, I don't know if you've noticed in my comment section, there's been a massive shift. People now defend doctors. They're like, this is crazy, this is that. Like, I feel like, yes, social media does matter. And honestly, TikTok algorithm, there's something different about it. People don't get it, but I believe that it changed the way that I view patient care altogether. Oh, I have another really important thing I wanted to say. One of the biggest things that I changed my mindset on with social media was the concept of gatekeeping somebody's health information. So if somebody asks me to run a panel of hormones and I don't think that their symptoms warrant that and it wouldn't change management, I would deny that. And at this point, it's like, or if they wanted me to run a genetic test and I was like, that's not like, this isn't cost effective. And then those are words that we've been given by the insurance companies. That's all from them. Like, because labs are actually not that expensive if you do them cash. Like, I've seen it, like you can do like a CBC for $3. So I started realizing that I do not like that we take so much autonomy away from a patient's ability to get their own health information, and with informed consent do things that may be harmful, but they're accepting it because they want to. You know what I mean? Like, I feel like I've changed so much about the autonomy of a patient. Um, but there's no way to do that in the system as a physician, because there's no way to cover your ass. Because if you mess it up and you don't have like a very thorough discussion with a patient about what these results mean or what they don't mean, or hey, this a colonoscopy is not benign, you could get this or that. You know, if you can't have those discussions, then you're putting your patients at risk without informed consent. But in the system that I'm in, I'm going to run those labs for you that you want run, and you're going to pay what you want for it, like you'll pay for it. And I'm going to be honest with you about what it can and cannot tell us. And you know what I mean? Like, so that is another big thing that changed in that social media changed, was I realized how kind of messed up it was that we gatekeep health information from patients. Like, we won't let them get information, you know? Anyway, I don't know. What do you think about that?
I agree. I think, I mean, as a neurologist, there's very little. Like, I feel like people generally just ask us for like MRIs.
Yeah.
It's not our workups. Generally, there's a couple of tests we can order, right? Um, but I do agree with you to an extent that, if someone wants like a thyroid panel checked and they're not having any issues, like if I ask my PCP that, they might be like, oh, well, what if it comes back abnormal? Like, how do we interpret it? You're not symptomatic. It's just going to cause issues down the line. But in reality, why shouldn't someone have that information? Right.
Hmm.
And yes, I feel like we've been discouraged to do that because it's kind of like, oh, you're not following the metrics, like it's not cost efficient, et cetera, et cetera, et cetera. But if someone wants to have information on like their vitamin D levels, fine, order it, I agree with you on that. And I
The
think if you
Yes,
are paying out of pocket and it's much cheaper, then like you're bypassing the whole issue. If anything, it might give
totally.
them peace of mind. It might make them feel listened to, which is
It
a win.
100% does, because The vitamin D wars, that is so crazy. Like the amount of discouragement to order vitamin D when it's like, it's such an easy, dumb lab, like that it's like, there's no scenario where your vitamin D is low that it shouldn't be corrected.
Yeah.
And like you could tell people, hey, just take a vitamin D and we don't have to check, but they don't get buy in. And that's a big part of it is having buy in. And part of them having buy in the plan is feeling heard and feeling like they had a say. And that's a big part of it. And I think that, oh man, it really is crazy. There are things that could be harmful if we start meddling with, like for example, if you look like, if your TSH is borderline high and you're asymptomatic and we start treating you for thyroid problems, then we could push you in the other direction, this and that. But have those conversations. You can have that conversation with a patient. Just because you order a test doesn't mean you have to act on it in a certain way. It's the anticipatory guidance of, hey, listen, if I run this collagen lab, it may or may, if it's positive, it may or may not mean you have Ehlers-Danlos. If it's negative, it may or may not need that. But it's information. And as we get information, as we've all seen, things change. We start to realize that things do matter and this should be checked. And like cholesterol is one of those ones, is all the new markers for cholesterol, like getting an extended panel of like different types of LDL and stuff so that you can actually better assess the risk. And if you had asked me 5 years ago to order certain types of LDL, I would have been like, that's not necessary, it doesn't change management, you know. And it's like, but guess what, now we know it does actually change management. So it's all about informed consent, telling the patient like everything, that like the reasons why you believe something should be done or not be done, and allowing them to make a decision within reason. If it's something like getting an x-ray, for goodness sakes, you know what I mean. Like it's just, it's crazy. So yeah, social media did that. Social media opened my eyes to that problem.
I mean, forget about asymptomatic. Even when you're symptomatic, as physicians, I know, when I have a problem going to the doctor, I know what should be ordered and I have to fight for that, right? They're like, no,
Yes,
no, like that's not, necessary. And I'm like, it is necessary. You need to order it. So I
exactly.
can't even imagine patients who, do not know. Um, and exactly, they go to Google, and Google give mixed information. So I think it's very difficult now in the era of this insurance. The doctors are handcuffed, and really, it's a huge problem. It's a huge problem, and I feel
Huge problem.
that it's not getting fixed. I hope that, as you said, with the social media, with us talking about it, we raise some awareness, but we'll see. I mean, I want to be optimistic, but we'll see. What is your final advice?
Actually, I wanted to kind of talk about that next step of what can be done and what are we going to do. Um, I have advice for patients. I have advice for physicians. So I'll start with physicians. I think it's really important for us to let our egos go a little bit and open our minds. And it's really hard because we've been traumatized and like kind of taught to be in this hierarchical thing where you let your ego go and recognize that some things that you think are truth may not be the truth. And open your mind about it. Like it's okay to for a patient to ask questions. Asking questions is okay. Don't let it trigger you that they ask a question about Lyme disease. Answer their question. So that's number one. Number two, speak up. Like basically we're all intimidated into silence about what's happening, but the reality is they need us. Like they need us. So like what are they going to do? Fire me because I talked about this on social media? Like they make so much money off of me. Like they're not, you know what I mean? They're not going to do that within reason, of course. Just push the limits a little bit. Try to stand up, and also pay attention to state legislation. And for physicians, open your mind to realize that we really are kind of brainwashed, and that we are very in this rigid bubble that has made us kind of enemy number one for patients, sadly. And then for patients, understand, just like you can have an off day, a doctor can have an off day. We're humans. We are not perfect. We are emotional. We have our families. We have our traumas. So if I'm not bubbly or I snap at you or something like that, like just like you would want to be given the benefit of the doubt, try to give us the benefit of the doubt within reason, of course. Open your mind to understanding the limitations that we're put under that are forcing us to do these things. Like, try to understand that system, because the faster we all understand it, the better equipped we are to address legislation. I want to give one example of a really fascinating legislation that's happening in a few states. There's legislation being proposed that hospital administrators have to have some kind of accreditation, like a licensure, that they're held accountable for ethics. They're held accountable. So, like, essentially, if you're a hospital administrator, you are accountable for your own ethics in the way that patients are treated, and you can have that licensure taken away. And that is a fascinating thing, starting to have buy-in from, and like, these are little things that we don't even think about, or prior authorization uh, legislation. Just pay attention, um, open your mind, and speak up.
How do people find you, Layla? I know after hearing all this, you might have some interested patients. Where would they go to book you or
Perfect.
book with you?
That would be great. You can go to my website, rebelandthrive.com. It's just REBEL and thrive, THRIVE.com, rebelandthrive.com. And it's pretty self-explanatory. That's where you can find me. You can find me on pretty much every platform. Dr. Layla is sad. Except for Blue Sky. I think I'm Dr. Layla's glad.
There is a lot more, I think, but we'll have to bring you back because, again, I mean, this is a fascinating conversation. There's a lot to talk about. There's a lot more to cover, even. I would like to know even more details about the DPC and the structure, and I would like to know, what are your thoughts on, for example, APPs? I mean, there's a lot more. Okay.
Yes,
Um,
yes.
So we'll have to really do this again.
Yeah.
But thank you for your time, and this was great.
Thank you for having me. I love this. I love complaining about medicine. This is my favorite pastime. So thank
We'll
you
do
both.
it with cocktails next time. Maybe some wine.
Yes. Yes. Sounds perfect. Awesome.
Well, thanks for tuning in to the Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.